We regret the announcement that the United States intends to withdraw from WHO, and we would welcome the opportunity to engage in constructive dialogue. There are also actions that the US government is taking that are unrelated to its intended withdrawal from WHO, but which we're concerned are having a serious impact on global health. For example, the suspension of funding to PEPFAR, the President's emergency plan for AIDS relief, caused an immediate stop to HIV treatment, testing, and prevention services in the 50 countries that PEPFAR supports based on bilateral agreements. Although a waiver has been granted for life-saving services, it does not include prevention services for some of the most at-risk groups. We ask the US to consider continuing its funding at least until solutions can be found. I feel sad when US is decided to withdraw, because I know its leadership and impact at country level and the same at global level. If the US wants to pay less, it's actually in line with what we're doing as part of our reform, because we have started in 2017 the sustainable financing reform that is helping us to broaden donor base. We are building a transparent organization, an accountable organization, a responsive organization, and we would respond to any queries or issues there are, and we hope US will reconsider and work with us to continue the reform that we have started seven years ago. Now to the Ebola outbreak in Uganda. So far, the government has reported 9 confirmed cases, including 1 death. More than 260 contacts have been identified and are being monitored. I thank the government of Uganda for its leadership and partnership. WHO is on the ground supporting the government's response. We're providing surge support for surveillance, laboratories, logistics, infection prevention and control in hospitals, treatment centers, and research. There are no authorized vaccines or therapeutics against the species of Ebola virus responsible for this outbreak. But thanks to preparedness measures that the government took after the previous outbreak and the global research collaboration led by WHO, we were able to start a trial of a candidate vaccine just 4 days after the outbreak was declared. Now to the recent surge in violence in Eastern Democratic Republic of the Congo, which has led to significant loss of life, injuries, displacement, and the destruction of critical health infrastructure. More than 900 deaths have been reported and more than 4,000 injuries. At most, only 1/3 of people who need health services in North and South Kivu are able to receive them. Anticipating an escalation of violence, we have been working since November to pre-position supplies, including medicines and fuel. However, these supplies are running out and others are running dangerously low or have been looted. We're continuing to respond as best we can. As always, the best medicine is peace. Now to Gaza. Since the ceasefire began in January, WHO has sent 139 trucks with supplies for 1.6 million people. We have supported the evacuation of 414 patients and 588 companions. We have also sent emergency supplies to hospitals in response to the escalating violence in the West Bank. We urge all sides to ensure the ceasefire in Gaza holds, hostages are released, and the violence in the West Bank stops.